we can be right back where we were months ago if we're not careful.
As the pandemic drags on with no real end date, people are understandably getting restless. So many of us have drastically changed our lives over the last 6 months. Good evening, everyone. Thank you for joining us at 11. I'm Colleen Marshall. Carrie Charles is off tonight. The longer the pandemic goes on, the more frustrated people get. And as COVID-19 case numbers decrease, some are easing up on the safety protocols. The Department of Health is reporting just under 1,000 new cases today, bringing the total here in Ohio to 147,000. ODH says more than 4,700 Ohioans have died as a result of COVID-19. But COVID fatigue is real, and doctors are urging people to think about the bigger picture. NBC4's Danielle Grossman is in the Short North. And Danielle, what are people doing, or maybe we should say not doing right now?
Yeah, that's right, Colleen. So if you come to areas like the Short North here, about half the people wearing masks, half aren't, but it's a lot more lively. People are getting out. But doctors are warning we still need to follow the protocols we've been following since the start of this pandemic, because things could easily get worse before they get better.
I see people easing up a little bit.
Yes. In fact, my husband and I were just talking about this on the way over. We feel like people have stopped wearing masks. We feel like they're being a lot less cautious.
It's clear that COVID fatigue is setting in.
I think it's boring, just like everybody else.
Lack of socialization, masks, social distancing, isolation, video chats.
They're all very sick of it. And it's annoying.
People want normalcy.
Yeah, absolutely. I mean, you want to talk about COVID fatigue. We've been living this and breathing this every day for 6 months.
OSU's Dr. Ian Gossenhauser says now's not the time to let our guards down.
We've been doing a great job. We've driven the numbers down. But if we stop now, we're in the third quarter of a pretty tight game. It can easily turn around and we can be in big trouble again.
Steph Day lost a loved one to COVID-19, and she says despite the frustration, it's simply what we need to do.
We need to make these sacrifices now so that we don't continue to lose more people, more innocent people.
And from firsthand experience, when Steph was diagnosed with COVID herself, the days before she got her results, she unknowingly exposed others.
I went through and notified everyone I had exposed.
Another reason she says taking extra precautions and quarantining is so crucial, especially right now.
Nobody asks an elite athlete, at the end of a tight game, do you still have what it takes to keep on playing until the clock runs out? It's just what we have to do. There's no choice.
But even with the exhaustion, frustration, most people are still listening to our leaders, hoping in time things will be a little closer to normal.
It's getting a little tiring, but we got to do what we got to do to keep people safe.
Now, Dr. Gossenhauser actually says that it's really important to keep those connections alive, whether they're virtually or they're safely in person. That's very important. And also remember to self-isolate. If you do have symptoms of COVID-19, isolate for about 14 days, and then after a positive test, make sure you self-isolate and quarantine for 10 days. Live and local for you in the Short North, Danielle Grossman, NBC4.
Thank you.